Well, right now, all the protocols that have been issued by the government of India are being followed at all the airports in Maharashtra. Particularly, you know that the Mumbai International Airport is one of the busiest airports in the country. Testing is on. We have also seen additional checks that have been put in place by the government of Maharashtra itself, and there is a compulsory institutional quarantine for all those persons who have been traveling from countries of risk. So as of now, apart from this, there is a continuous screening process that is going on for people who did enter Maharashtra from all these countries between 1st of November till the time the other restrictions had come in place. Contact tracing has been done quite aggressively, and that is how you see that all these cases are currently coming ahead. We've also seen that right now screening is going on even with respect to the high-risk contacts of all those persons who come from other countries as well, which are not directly at-risk countries. So the government says that on one hand, it is rigorously testing persons. On the other hand, the field facilities which have been lying vacant for the past few months are also being readied in case of a requirement, in case the number of cases go up. In any case, the number of vaccinations in the state have gone up after these cases have started to be reported.
All right, Ranjan Sharma and Vinaya Deshpande getting us all that perspective. I'm bringing in Dr. Dewan into the discussion, who's joining us on the broadcast. Dr. Dewan, it is a reality that we'll have to face, and we'd have to make sure that our guard is up. But the number of cases detected with this new variant are likely to increase. Would that be correct to say?
Yes, definitely. See, what the medical literature says, whatever we have seen and we have read from the South African colleagues, and we are in regular touch with some of them, is that the transmissibility is quite high for this variant. Although they are not very sure about the severity of the disease, how much severity it causes. Normally what happens is that once the mutations continue to happen in the virus, the transmissions may go up, but the severity may not go up. So it's not necessary that every mutation that is transmissible is also equally responsible for the severity of the disease. So yes, I agree. We are looking at increase in the number of cases, but then we have been discussing it for last 2 years now that the COVID basic protocols need to be in place. People can't get rid of the basic COVID prevention protocols. And I feel that vaccination will make a difference, because see, the efficacy will be in question of the vaccine, but whether the vaccine will not be effective, I don't agree. The current vaccines will be effective against the new variants also. The efficacy may go down, but still should be good enough to prevent the severity of the disease.
Two questions, Dr. Dewan. Are our children vulnerable? Because we have seen certain cases of hospitalization in certain countries that you were talking about. And secondly, is there a strong case to make for booster doses for the vulnerable, elderly, the healthcare workers?
Is this a question for me?
Yes, Dr. Dewan, to you. Yes, Dr. Dewan, please go ahead.
Hello?
Yes, sir. If I'm audible to you? We just try and fix that line. I think there's an audio problem with Dr. Sandeep Dewan. But as I was talking about that, most of the cases which have been detected here in India have very, very mild symptoms. Most of these people are doubly vaccinated, so that takes care of a lot of concerns. There is no conclusive data to tell us that vaccines will work, but there is no data to say that vaccines won't work. Common sense says that vaccines are likely to work, and as Dr. Dewan said, the efficacy may come down. I think Dr. Dewan is back with us on the broadcast with that problem being fixed. Dr. Dewan, 2 points on which I wanted your view. First, are our children susceptible, more vulnerable under this new variant, keeping in mind that there are certain cases of hospitalizations and severe disease which have been reported from some parts of the world where this variant is being found right now? And the second part to my question, that does this make a strong case for booster doses for elderly, vulnerable, the healthcare workers?
See, children are now anyways a susceptible population because they are non-vaccinated. So if you look at the data from US and Europe, US started vaccinating children above 13 years, I think 3-4 months back, which we have not started in India. So I think children less than 16, less than 18 years, in fact, pediatric population by definition is less than 16 years, are now more susceptible because they are non-vaccinated. So whether it's Omicron or Delta or any other variant which may come in the future, the children will definitely be more prone. So it's important that we protect them because of the non-vaccination status.
Sure.
Second, coming to the booster dose, I think it is high time now that we start thinking about booster, particularly to the vulnerable population. And the reason is, if you look at the vaccine, science behind the vaccine, the booster anyway is required after every 1 year, whether it's a booster for pneumonia or H1N1 or any booster. So most of the population which started vaccination in January will be up anyway for their booster in January, which will be completing 1 year. So I think it's high time we start thinking about giving booster dosages to particularly vulnerable population, which I mean by healthcare workers, police personnel who are actually doing active duties with these kind of patients, and obviously elderly population. So yes, it is time that we start allowing booster dosages for these patients.
Dr. Dewan, to ask you very frankly, then why is it that so far we don't have a policy on booster doses? How do you read or perhaps understand the hesitation of the Indian authorities or the leading medical bodies in this country, including the ICMR, when it comes to booster doses, when they have proven to be very, very helpful when it comes to these new variants? Dr. Sandeep Dewan, if you can still hear me. All right. I think we're facing an audio issue once again. But we try and connect with Dr. Dewan and get you more perspective on this. But so far, what do we know? That the cases of Omicron variant are rising here in India. We have 7 more cases plus 5, about 13 of these cases which have been detected. Dr. Dewan, I think you're back with us on the broadcast. I wanted to ask you that how do you read the hesitation of the Indian medical authorities and the Indian government when it comes to booster doses? We don't have data per se, but there is overwhelming experience and perhaps certain degree of data from across the world that booster doses does help.
I think the reason being, and I'm not into public health, so sure. I'm a critical care specialist, but I feel the reason is that most of the authorities, at least at the government circles, are more keen on, in fact, giving first and second dose. We have a large population, isn't it, to cover. So I think the government is very, very keen on completing the first and second dosages of the population as much as they can. But having said that, I think that is where the hesitancy is coming from. If you are looking for the data for booster will never be robust. See, please understand, as I told you, why we need sure. a booster. We need a booster because after a certain period of time, the efficacy of the vaccine goes down. The antibodies that are formed, they will go down. And it is proven in various other vaccines in the last 10, 15, 20 years. So these kind of vaccines which are made against viruses do not give lifelong immunity. So anyway, the booster has to be given whether there's a data right now or no data, because booster data normally will not be as robust. There will not be many trials on boosters as it's the first booster that is being given. So I think we'll have to push for it. The medical bodies have to push for the booster dosages. And
so very briefly, the priority should be the healthcare workers?
Definitely, because we have already started receiving COVID patients in our ICU. Yeah. At this point of time, I have 4 or 5 patients of COVID in my ICU at Fortis. So yes, the healthcare workers are a vulnerable population, and the governments and the authorities should start discussing about giving booster dosage to start off with healthcare workers at the first time.
Dr. Dewan, thank you so much for joining us this evening and sharing your views on this very important story.